Today we are going to talk about the changes that occur in the process, including the pregnancy control. You could say that pregnancy represents a very important moment for a woman because of the end result, which is the baby. Nonetheless, it also represents a series of transformations that the mother will undergo at a morphological level, such as physical as well as physiological, including alterations to the body's organs and the systems that make up the body. Well, Alejandro, what are the changes that occur in the body of the woman?
The changes that are going to occur in the body of the woman are very diverse, and we are going to try to summarize them by time. In the first 3 months, or the first trimester, the first changes that we are going to observe are, firstly, there is going to be a ceasing of the menstruation period, which, as we mentioned beforehand, is going to be a result of being pregnant. Once that diagnosis has been properly confirmed, we can also observe that there will be some alterations in the functions of the body's diverse systems, such that a cardiac and also circulatory system, in which it will be accompanying and getting used to there being a new being in the woman's body. At the cardiac level, the heart's job of pumping blood is going to increase in such a way that there will be an increase in the heart rate of the mother and also in the blood tensional levels. The first 3 months is normal for a woman to be very hypotensive or low blood tensional levels. We normally see it in women who are very thin, although those who are of shorter stature, other changes that can occur are also due to responses of the hormones, which are functioning in a way that there will be an adequate adaptation of the uterus in the fetus sac, and proper implementation in the uterine. In this case, it would be the progesterone and the estrogen. You also see the commonly referred nausea and vomiting in the first trimester. Other changes that there will be also an increase in the bust size in the mammary glands of the woman. This is going to be due to a process in which the progesterone production of the woman is going to be due to the loosened corpus in the uterine, and also due to the placenta of the baby. What is this for? This is for so the mammary gland can fully mature in women. This is represented as ending its growth stage and maturity when she is pregnant and lactating with her first baby. This is going to be due to the baby occupying the nutrition from her when the baby is going to be born. These would be the most common changes that would occur in the first 3 months. In the following 3 months, what we will find is that the side effects of pregnancy, in which you may begin to find some pains in the lower abdomen. This is going to be due to the uterus increasing in size and going to be closer to the belly button. You can find that the woman presents a sensation of pulling or just an uncomfortable in her bust region or genital area. And this can continue developing as the pregnancy continues. You may also observe more frequent visits to the bathroom. This is going to be due to the uterus growing, which is going to cause a push or moving of the bladder, which is in the front, and this results in a lowered capacity of the uterus. In the 3rd trimester and last trimester, we will find that these signs and symptoms will be multiplied and will be more common. Pain in the pelvic region is very common, and uncomfortableness in the genital region. You also find a lower capacity in urinary retention, and also in some cases you will find some greater difficulty breathing in some positions, such as laying down face up or in a supine position, which is the medical term. It is recommended that the woman lies down in a lateral form or prostration, on the left side in order to provide a greater oxygenation to the baby and also lowering the need to increase the mother's respiratory rate. It is also recommended that placing some pillows on the back, and this will result in lowering the chances of these cases occurring. As the pregnancy continues to develop, the baby will continue to gain weight and will develop more mass. You will also observe that the nutritional demands and the needs for oxygen will continue to grow. You will find that the cardiac force, as we mentioned beforehand, will be increasing in the end. Obviously, the need is going to be greater. It will require more oxygen in such a way that we will find that a normal edema in the pelvic areas, normally this occurs around the week 36. This is when they present edema in the feet, legs, and even in some women manifests itself in such a form that they can't wear any shoes. Only sandals would be tolerable for them. It is very important that this is explained to the woman that these can be physiological changes. And as we mentioned beforehand, that there is going to be a certain link into the physiological area in between the cells. This will result in edema in the legs. And it's also very important to differentiate this from any obstetric illness. In this case, the obstetric illness that causes edema is the preeclampsia. In a certain control and in a certain way, this will be differentiated by the way that she goes on throughout her pregnancy control.
Alejandro, one of the symptoms most commonly associated with pregnancy is at a gastrointestinal level, usually shown by nausea, heartburn, vomiting, constipation. Normally, patients will come and ask, "Doctor, why is this occurring? Why is this happening to me? What happens at a gastrointestinal level? Could you please explain this?"
Well, what happens at a gastrointestinal level is that it generally is greatly affected in a way that its motility can be altered. And in this aspect, the lowered motility can present constipation. Also, with a lowered motility, the stomach produces more caloric acid, and this will cause a sensation of heartburn, will cause acid reflux. This is generally found in the first trimester, but can also be seen throughout the others. It also depends on the organism of the body. There are some women who already have a history of colitis or irritable bowel syndrome or constipation, which obviously with the pregnancy, this is going to be magnified. And there are also others, varies in depending on the quality of their nutrition that the woman is given. If the patient has a low or bad nutritional state, lots of foods that are irritating, consumes lots of acidic foods, or really spicy foods, well, obviously these symptoms are going to be magnified. Firstly, these changes occur because of a hormonal change that occurs throughout the pregnancy. And then the other is by the individual physiological needs of the body.